At this point, are you basically saying...
And then we'll move to you.
Thank you, Tom. You might as well stay. How is it that you can open it up to walk-ups? Are you having a flagging interest in people signing up for appointments?
So this week we definitely have more availability than we've seen demand, but there's a couple of different things at play. So I think something that's always been important to us is to be extremely responsive to what we're seeing. So noting the demand, we're looking at shifting towards the next phase where we continue to meet Rhode Islanders where they are, decrease and reduce barriers to getting vaccinated. So one of the things that the governor had shared is we are signing people up at a similar rate to what we've seen over the last few weeks, but we've never had more vaccine available in the state than we have this week. So that's part of what gives us the additional flexibility to offer that walk-up opportunity. We've done it already this week. We've had about 500 people walk up at some of our mass vaccination sites. Again, I strongly encourage people to register because then I definitely have a shot for you. But we'll also be offering walk-ups on Friday and Saturday as outlined.
Interest not falling off?
I think it's a combination of urgency as well as, the confidence that we've always been working towards. I think traditionally when large age groups have opened, people have recognized it's taken me several weeks to find an appointment. So I think that's part of it. But again, we are going to continue to learn and adjust and make sure it's as easy as possible for people to get vaccinated.
Governor McKee, good afternoon. So why are we still under a state of emergency?
Well, as I said, this is too early to put the sign up, mission accomplished. I think the doctor was very clear in terms of the risk for people who are unvaccinated. I just got a text from somebody that just got diagnosed with the COVID. So we're not there yet, and we're going to be safety first. We're open in a way that we believe is safe, and then we're continuing to look at May 28th as the next target date.
Drill down on exactly what that means. I've heard there's a financial component. What is keeping you from lifting the state of emergency? Are there any other components that we're missing? That there's money available from the federal government? What is it?
No, that's not it at all. I've mentioned that safety is the #1 priority, and some people might be out there saying this is a dream. This is not a dream. This is a nightmare. And we got to make sure that we get over that finish line, and we're doing everything we possibly can to keep everybody safe. So the message is, as I said in my comments, we're going to stay the course, and that's what we're doing. And we're incrementally opening up, very sensitive to the needs of the people that own businesses, but we're doing it in a way where we believe that it's in their best interest what's happening right now. And you're going to hear from businesses that we've talked to yesterday that are feeling as though that we are making that progress, and we're doing it in a way that's keeping their customers safe.
Are you basically saying...
Governor,
are you basically saying at this point, I know Dr. Alexander Scott used the term personal responsibility, that come the end of May, hey, we've given you the chance to get the vaccine, now it's on you. If you don't take your chance to get it, you're putting yourself at risk, and that's why we're moving forward?
No, I don't anticipate that be the case. Personal responsibility is always in the mix, right? But come the end of May, if we stay on target to the numbers that we have, we're going to have a big portion of the state of Rhode Island vaccinated. And you'll see the numbers at the end of this week, as Tom said. We have more shots to put in people's arms in any given week than we've had since the COVID started and the vaccination started. So I think there's another, almost 6 weeks between now and May 28th. We're going to vaccinate, especially if we're able to get out, as Tom has suggested, and we've got these plans, obviously, that we're going to make sure that we're going to do reach out. We're going to be, I think, at Amgen next week with with several hundred shots. We're going to be at another, I think, electric boat at one point in time, many shots. That's a message out there that we've got businesses that got large numbers. We're going to go out to where people are and vaccinate them. So by May 28th, Brian, we expect to have a large portion of the state of Rhode Island vaccinated.
On that
front, I know you talked the other day about going to colleges, and there's been some concern at URI and with the strains. Have you made specific plans to get the vaccine to colleges? And I know Tom talked about some of the reasons for there still being open appointments, but is there at all a concern at them not all being snapped up immediately?
Yeah, I think that we're going to end up on the college campuses. Right now, we're providing transportation, and the college campuses have indicated they're going to our sites. But you're going to see, as we get into that last 25, 30%, that we're going to get back to the local spots, exactly where we started. So we're going to be on site, back local. This is not over, to the question that was just asked by Jim. There's work to be done, and we're going to do that work. And we're willing to go out to high schools and vaccinate 16, 17, 18 if they want us there. When the time's right, we'll pull that. We'll make that happen.
But you're not concerned about the appointments?
No, I'm not concerned where we are right now. I think that we're showing there's reasons that we have extra supply this week. It's because we built the capacity, and we're going to continue to get the supply as long as we make sure that people show up and get their shots.
Governor McKee, irony can be loosely defined as a Rhode Island restaurant managing to survive a year of COVID shutdowns, then ultimately fail because of their inability to compete with government benefits, which have placed them in a position where they're functionally unable to staff up to meet consumer demand. Currently, House Bill 6218 is still currently pending, which would address these issues. What has been accomplished, and I want to stress, Rhode Island businesses are no longer interested in discussions, big meetings, lots of clipboards, lots of pontificating. What has been accomplished with regard to the Rhode Island employment crisis?
Well, it's a national thing, not a Rhode Island thing, right? So we've been on calls with national people. This is a national problem that has been brought on by a little bit less than in-depth thinking in terms of Washington, in terms of the impact it's going to have. We are definitely going to work on a Rhode Island solution. I would expect that that's going to happen within the next week. And yes, we have been talking to the restaurants, so we're not ignoring the restaurants. And I understand it's not just the restaurants, by the way. Please don't think it's just the restaurants. It's janitorial services. It's daycares. It's childcares. So we can't look at it just as restaurants. It's a more global issue than that. And my feeling is that Washington has a responsibility on that, and I would expect that our plan will reflect that when it comes out.
Just a quick follow-up. House Bill 6218 has been pending for weeks. There is a solution locally. We are just a couple of weeks away from Mother's Day.
Phil, go ahead.
What's going to be done?
I just answered the question.
Yeah, Phil, go ahead.
Doctor, this morning, Dr. McDonald on a talk radio program said that we're seeing an increase in younger people with COVID-19. How young, how many, and what is that attributed to vaccine availability for people in that age group?
So it's a combination. We are seeing more cases among younger individuals starting from 10 to 24. That is connected to a number of things, one of which is the fact that those who are younger than 16 are not eligible for vaccine as of yet, which is why we strongly want to promote anyone around those individuals who is eligible run to go get vaccinated, to be able to help protect those around them. The others are that, things are opening up, the weather is getting better, people are getting more active, sports activity, different engagements are occurring. What we tend to see, however, is actually household transmission taking place. So as we continue to reach the milestones that we are striving for, 70% of our eligible population getting vaccinated by May 7th, and 70% of our entire population getting vaccinated by May 28th, we will see this occur less and less. But because of the variant and how more contagious it is, it's important, it's critical for everyone to know that we are not at the end yet. The more you can get vaccinated, the lower your risk will be of spreading coronavirus.
A number of a percentage of the 1.6% positivity rate that are people who are age 10 to 16, even a rough estimate.
We do have that. We'll get that to you directly.
Yeah, we'll get you that info. James, Alexa, Patrick, Anita.
Governor McKee, this is James Bissett from the Providence Business News. Good day to you, sir. You may mention earlier that you were hoping to kind of reach out to colleges and even to maybe some high schools to try to encourage some vaccinations. We've talked to a couple of people over the last day or so, those that are in the 30s, where they still see some vaccine hesitancy among those between ages 16 and 39. Even as of today, there's still about more than 5,600 vaccine appointments available on vaccineri.org. So what do you think the state would need to do to really change its messaging in order to encourage the younger demographic now to really get the vaccines into themselves? And especially now with the state having its goal of May 28th to really, with the exception of masks, fully reopen, and with the hopes of not having to have to take that step back if people aren't vaccinated.
Well, you're going to ratchet up. You can continue to go where the people are and identify those areas. As I explained a little bit, I think that earlier Brian asked, am I concerned? I'm not concerned until we reach a week where we didn't vaccinate all the people that we have doses. And so I would expect that, this week we're going to vaccinate those 5,600. That's why we're here today. You still have time to do that. And we're amending the way that we're approaching, including walk-ups, as Tom said. And then we're going to go direct out to businesses. We're going to go direct out to anywhere where we feel as though that people are there. And in those particular age groups, we're going to make sure that we are doing the same thing with the BIPOC community, right? Same thing we did with the teachers, same thing we're doing the universities now. That's all in the plan. And I was on a White House call this week, and they were very recommended that you should have a month plan. So that's what we're in the process of right now. I would be concerned if we hit the point where we have a number of vaccines, an inordinate amount of vaccines left over after any given week. Right now, we're not there, and that's why I'm not concerned. And I do believe that we're going to hit high percentages based on the activity that's going on right now.
In addition to meeting people in person, do you think there could be some additional marketing things, like maybe doing some either YouTube ads or maybe reaching out to people on social media?
I think that what you're going to do is you're going to go where the people are. And we're backing out the numbers. I was backing out the numbers this morning with Tony Silva, talking about how we're going to reach higher percentages of population and higher percentages of population. If you're strategic in that way, if we're able to continue to get the message out, that's going to happen, and I believe that the state of Rhode Island is going to respond for many reasons. Safety issues, economic issues. We want to get the kids back to school. So I think it's all going to happen.
Thanks, Governor. I have a few more questions, and just a reminder that we do have Director Floyd and Commissioner Green here. So I believe that Alexa was next.
Yep. Governor McKee, both Neighborhood and Blue Cross Blue Shield of Rhode Island have said that they will continue to cover COVID-19 treatment and tests as long as there's a state of emergency. Are you not ending that because of this reason whatsoever?
No, the reason that you have a state of emergency is because we still believe there is one. And when we get to the point when we don't feel as though we have one, we'll remove that state of emergency. And I think that there's many factors, but the main thing is the safety issue, and it's based on. I think I mentioned this weeks ago that our goals was that 70% that Dr. Alexander Scott says. We've stayed true to that. We just got to hit those numbers and exceed those if we can.
Question as well, just a second one for Tom McCarthy, please. When you say that you want to reach people where they're at, and the governor just said that he would go to high schools, he would go to universities, what about people in extremely hard-hit communities that I know that you guys have focused on? Are you going to, certain zip codes in Providence and going door to door to people, not just to sign them up for the vaccine, but also to deliver the vaccine to them?
We are. I think there could be an opportunity in the future. So as you know, we have been vaccinating homebound Rhode Islanders. We're continuing to look at other opportunities. I know there's been some fantastic work. The city of Central Falls, the mayor is going door to door, knocking on doors, having conversations. They're doing similar things in Providence and Pawtucket, but continuing to very quickly recognize that we need to make that shift. And as the governor shared, going to places of business so that I have to work during the day and then take care of my kids at night is no longer a barrier. So it's things we'll continue to look at. I think what's also important too is to put aside some of our kind of preconceived notions. What I'll say is we've seen really strong demand from our 20 to 30-year-olds, so far. So what we're trying to do is make sure that, we have a message that resonates with folks, recognizing all the different perspectives and backgrounds. But so far, the younger Rhode Islanders are stepping up, doing their part. Would love to see the rate increase among those 40 to 49. Nothing to wait for. I've got vaccines for you this week.
Given the low risk of infection outdoors and the desire to want to encourage folks to do things outdoors, why not lift the mask order when you're outdoors completely? Wouldn't that be a cleaner message, easier for people to understand and to kind of grasp and have the, well, if you're 3 feet, then it's you have to have a mask. You should keep it on you when you're outdoors. Why not just lift it for outdoors?
Specifically because the risk is low, it doesn't mean there is no risk. The risk does continue. It does not go away completely. So for right now, we want to take it in a step-by-step fashion. Still really encourage, if you're around people and you're outside and you don't live with them, wear a mask. Just because it's no longer required doesn't mean it isn't still recommended. Same for 6 feet distance. People have the opportunity to maintain the distance, the protection, the wearing the mask, and getting vaccinated that we want to equip all individuals and all families with being able to do to protect themselves and to protect their household.
And Governor McKee, if you could elaborate on the unemployment insurance thing that you expect to happen, do you expect the General Assembly to pass the legislation that Director Weldon has supported, or is there something else? Is there an executive order or something else that you're working on with regard to unemployment insurance?
Both. This is certainly an emergency for the businesses at large, so an executive order is a possibility, but you got to find the right formula there, right? Because we got to make sure that it works for all the businesses, and we're exploring that right now. If you have ideas there's no state that's figured this out yet, so we'll be the first if we do, and I intend to make sure, like I said, we're going to make sure that we'll use the $300 to an advantage, put it that way, the federal $300 to an advantage, and we're going to make sure that we put a system in that does just that, because like I said, Washington didn't think this through. We sent letters, I sent letters as Lieutenant Governor asking for this consideration or thought process when there was $600 when I was Lieutenant Governor. So we're in a spot where we got to figure out how to solve the problem. It could potentially be through an executive order. It could be through legislation. And we're working with DLT right now over the last several days since last week on this thing. So I would expect something to break. And we'll when we get the details for it, we'll certainly share that, because we want it to be successful once we come out with the ideas that I'm considering and others are suggesting.
We'll have the last question.
Governor, I have a question about proof of vaccine and vaccine passports. A lot of states are curtailing the use of them. Does the state plan on using some sort of proof of vaccine requirement at catered events? I know the testing requirement is no longer there. Do they have to show that they've been vaccinated instead? Where does the state stand in terms of vaccine passports?
I think as Stefan has talked to that, we'll certainly work with individuals that want to make it that way, and in there, part of the universities in the state are making a requirement for students to get on campus, I think broadly across all universities. So we'll work with anybody, and as Stefan mentioned, in terms of like help walking them through strategies that we can offer, that could be a strategy that we could help them through, but right now we're not going to mandate that from our seat. We'll work with the local businesses and different organizations that are having these events to see whether that's something that they want to do, and if they feel as though it makes them safer and they can put a sign up that everybody in here is vaccinated, they may very well do that, and we're very happy to walk them through anything that they think is going to help their business or their activities.
With the testing requirement going away next month, do you plan on requiring at catered events proof of vaccine instead?
No, we're not doing that right now.
Lastly, we're still seeing hundreds of new infections a day. New York Times put us #2 behind Michigan. Will you continue to lift restrictions if this is the same case a month from now?
Well, it all depends where we are in terms of hospitalization rates and also the infection rate. So it all balances out. we're following the science. You get people vaccinated, we're not going to have that problem, right? So we need to make sure that's there. And also understand, the people out there understand that the metric that you just referred to, we're about, what? It's about 100% more in terms of the spread between us and Michigan. We're nowhere near Michigan right now. I think they had 70 some odd percent, and we were at 40% or something like that. So the spread is significant. We'll keep an eye on that, but we're not close to where Michigan is right now.
Last question for Amanda.
Thank you. My question's for Janet. Can you speak to the indoor sports? What will restrictions look like? For example, will there be a limit on how many spectators can attend?
Thank you. What the governor announced today for indoor higher risk competitions was that we will allow those to occur starting on Monday, which opens up, for instance, the wrestling season for high school spring sports. The occupancy limits for indoors still apply. The spectator rule that got changed allows not just parents and guardians and siblings, but also grandparents who are hopefully vaccinated and other folks to attend, so long as they abide by masking and any occupancy limits. We are strongly encouraging that there be testing, regular testing for anybody involved in sports, and particularly for higher risk sports. So for instance, the Rhode Island Interscholastic League is going to require that those who compete in wrestling have regular testing. So you make sure, and as mentioned over and over, 16 and under aren't being vaccinated. So you make sure if you're asymptomatic and positive, you won't be participating in a wrestling match. So I want to stress that we're sort of opening up this last group of sports that hasn't been allowed to compete, but urging that people do it with every modification that can help prevent spread of COVID for the athletes. Things like for wrestling, they're going to have pods. You don't have different weight classes wrestling against one another anyway. They're going to have other modifications in place that will prevent transportation or things where a lot of the spread's occurring outside of sports, so trying to prevent people from being too closely congregated. I think one of the things we've seen is that the high school sports and the middle school sports have been very well organized and disciplined. We want to get the word out more to other rec leagues and recreational sports, where we think that maybe more attention needs to be paid to some of the other requirements like masking and distancing. So that's something we'll be working on in the weeks ahead.